Hello, everyone. This is Edwin John Rodriguez, your health insurance representative. Today, I'm going to be showing you how to search for new Part D drug plans. In this lesson, we're going to show you exactly how to do this process with some basic information like your zip code and your medications. Using this on an annual basis during the annual enrollment period allows you to stay ahead of the cost and changes related to your drug plans. As a reminder, every year between October 15th and December 7th, you're able to make changes to your drug plan and update it for the following year starting January 1st. Now, I recommend doing this for all of my clients. For anybody who is on a Part D standalone drug plan or that drug plan along with a supplemental policy, it makes sense to do this. As you see here in a moment, you'll see the difference in savings or more so cost related to your drug plans based on your specific medications, if you have any preferred pharmacies. And what this tool will do is allow you to find the best option based on your needs. Essentially, it brings the cream to the top. So I'm going to show you that today. Let me share my screen here with you. And as you can see here on my screen share, this is going to be a link that's going to be available to you in the description below. I also have it as a pinned comment at the top of the comment section so you can access this link. The purpose of using this link, two reasons. One, it supports the channel. It connects your file to me. So I get a small commission for helping you out with this information as well as the update. And secondly, it also allows me to be here as your resource. So if any questions come up in the process, as you can see, you have my contact information right up here in the corner. So if you do have any questions in the process, feel free to reach out, but I'm hoping this video explains the information in better detail for you. Again, I recommend clients do this on an annual basis in that enrollment period I stated before. All right, so first we're going to go here to the zip code section. So I'm going to use an example of a customer that I actually spoke with yesterday. So we're going to be using this client's information for the sake of this example. So first we're going to put in the zip code here, which is here in Claremont, in Lake County. Pulls up their zip code and you can hit find or view plans. And then from here, you're going to want to go to the drug plan section, which is a check mark here, or excuse me, a tab here. And automatically, without any filters, it's automatically going to just start pulling up different drug plans based on your zip code, the options that are available in your zip code. But we want to get more specific. We want to identify what is your best drug plan. So we do that by adding preferences. If you use this blue link here, that will take you to the section where you can actually add preferences. For the sake of this video, we're actually going to be talking about specifically prescription drugs. So we can click this link here where on the left it says prescriptions. And this allows you to enter in the medications that are important to you. So we'll do that here together. So the first medication for this client is going to be called baclofen. And when we select that medication, it's going to give us some different options. On this medication, specifically for this client, it's a 10 milligram medication, and it asks you right next to it, how often do you use this medication? So, or how many do you use in a month? So somebody who takes it 3 times a day would be 90 tablets. Somebody who takes it twice a day would be 60 tablets for the 30-day supply, which is the case for this client. Then you hit add. And then second, you can add the next medication. For this client, rosuvastatin is the next medication, and this one specifically is 20 milligrams. And this is a 1-a-day medication. So we have 30 tablets for a 30-day supply, and we hit add. And last but not least, we have another medication here called enalapril, which there's 2 different versions. If you see on your prescription bottle, it says HCTZ, which stands for hydrochlorothiazide. It's a combination medication, so there's normally 2 parts to that, but this is just a regular enalapril for this client, so we'll select the first option here. And then we'll see the dosages available, which in this case it's 20 milligrams. And this is also a once-a-day medication, so we hit add. Now we have the client's 3 medications here. You can just verify that the medications that are important to you are popping up. And you can go back and edit using this button here. If you have any changes you need to make, you can also exit and remove medications that may have been in your file from the past. Just as a side note, while we're looking at this here, while we're talking about a file, if you notice here at the top, you have an option to create an account. When you do that, it creates an internal account for just you and I, And what that allows us to do is access this information on an annual basis for yourself if you help yourself, or for me if you get me involved in the conversation. I'll be able to help access your information and be able to pick up right where you left off and be able to jump in and help you. But again, by doing this, you'll have this reference for every year, so you can go back in, you can add, remove medications, and do the shopping on an annual basis. So once these prescriptions are entered in, you go ahead and hit continue. And if you have a preferred pharmacy, you can enter that in here. Now, most folks, they're just really looking for the best pricing when it comes to prescription drugs. So if you start adding filters related to these medications, they'll start to skew your results. So if you don't really have a preferred pharmacy or preference, you can just leave this blank. But for this client, they did prefer to use either Walgreens, or in this case here in the South, we have Publix. So we'll add those two pharmacies in here as preferences, and we hit continue. And voila, this brings us to our options. So now this filters automatically based off of the lowest plan premium. As you can see here under the sort option, it gives us the least expensive plan based on the premium only. Now that's not how you want to search this, because the cheapest premium doesn't necessarily mean the cheapest overall for the year. The best way to shop this is to use this drop down arrow and select the second option, which is total annual estimated cost. Now what this does is two things. One, it's gonna account for the actual cost of the plan itself. So in this case, this plan is actually a zero premium plan, but more importantly, it's also going to include the estimated cost for prescription medications. So if you can see here, the prescription cost for this plan is around $46 per year for the next year in 2025. So if I had to guess, this is probably going to be the best plan for him, but let's hit the filter just to verify. So we hit total annual estimated cost, and boom, as you can see, the second option actually changed, but it kept that original one up top because it does tell us this is your least expensive plan for the year based on your medications, as well as the premium for the plan. So now, if you want to go ahead and enroll in this plan, this is really the end of it. You can look into more details here if you prefer, but if you want to compare additional information, you can, let's say, pick the top three. That's what the maximum it will allow you to compare. The top three results that came back, and now you hit compare. And doing this here, it will give you an idea of what your estimated annual cost would be between the actual prescription itself as well as the premiums for the plans. And as you can see, if somebody in this case, if this client had the Humana RX plan, the Value RX plan at $41 per month, just by switching to this other plan here, the WellCare Value RX plan, they'd be saving over almost $600 per year on their prescription drug costs. So this is, again, exactly why I recommend looking at this on an annual basis to make sure you're getting the best price for your prescription drugs by using, again, the link in the description below. That allows you to connect to me, and I can help monitor the process for you as well. Okay. So again, going here, these are your results. These are your top three results. Unless you have a brand preference, most folks don't. They just go straight with a plan that's going to be the most cost-effective plan. In this case, this is going to be the WellCare Value script. And you just add this to cart. And you hit this button to continue to apply. After October 15th, it will take you right to the section where you start to enter in your information, name, address, phone number, your Medicare number, how you'd like to pay for that drug plan. If you're drawing Social Security, you can have it come out of your Social Security check automatically. If you're not drawing Social Security, then it will give you the option to set up payment there as well, whether it's a bill where they bill you directly, or if you can set up auto pay from something like a checking or savings account. So just to go back real quick, I also want to show you some additional information. So if you want to actually look at additional details related to this plan before you cash out, you can actually hit this button here, View Details, and it will pull up all of the details related to this program. So there's a lot of details in the background that makes these plans differ from one plan to the next, but it does give you a light overview here. So this plan does have a prescription deductible of $590, but as you can see here right below, the deductible is zero if it's any medications that are tiers 1 or 2. We'll show you more detail in just a moment. So what this means is if you have any prescriptions that are tiers 3, 4, or 5, right, then you're going to be responsible for a $590 $590 deductible first before the plan helps you out with those medications. Now, in this case, this client did not have any tier 3 or higher medications, so this is why most likely this plan is the one that came up as their best option. Again, a reason why you want to look at this on an annual basis. But for this client specifically, their medications fall in the tiers 1 and 2 category, so this deductible wouldn't matter for that person. So again, this tool does all the work for us. We don't have to worry about doing the math and trying to figure out what makes sense. We enter in the medications, we enter in our pharmacy, we hit run, boom, it gives us our option. Right after that, you can filter out based on total cost. Boom, takes you right to the top. It takes you right to the top where it will show you what the most cost-effective plan is based on both your medication cost as well as the premium itself. So I would trust the system in that process. But to go over some additional details to this plan, the premium again is $0 monthly. The estimated cost for prescriptions we'll look into further here in just a moment is around $46 per year. It gives you the idea of what your cost would be for any prescriptions that are tiers 1, 2, 3, 4, and 5. Those are your tier levels here based on preferred pharmacies. That would include Walgreens as well as the Publix. Okay. Now, it tells you also 90-day supplies. You also have additional details down here you can download. So you can hit this button here. This is the summary of benefits. And I just held the control key while I clicked on that, and it popped it up into a new screen. And this will be the summary of benefits for that plan. So specifically, we're talking about the value script program here, which is the information related to this plan. But it has the 2 other plans in the same book for WellCare as well. Okay. But going back up to the prescription drug portion, so if you click on the prescriptions section here, this will actually give you a breakdown as far as what the monthly price of these medications will be, as well as the estimated retail cost for these drugs. So the retail price is if you don't have insurance, let's call it, right? The initial coverage is going to be when you actually have your insurance and you go pick this up at the pharmacy. So this medication, enalapril, it's not going to cost this client anything. It's a 0 copayment monthly for this medication. The second one is the rosuvastatin, which is also a 0 copayment for this prescription. And then lastly, it's going to be your baclofen. So this one is categorized as a tier 2 medication, which comes out to $3.85. So just for good measure as well, you can also click on this tab here. If you have your other preferred pharmacies, just to dial between back and forth, you can see what it would cost if you use Publix. And that would be 0, 0, and 5, or Walgreens again, which is 0, 0, and $3.85. So this client will save a few dollars every month by using or a couple dollars every month by using Walgreens as opposed to Publix. Again, so that is how you shop your Part D drug plans. After October 15th, then you'll be able to go in and apply for the program. Within about 7 to 10 days after your enrollment is completed, you'll receive your ID cards and your welcome package for your program starting in the new year. Okay, so again, this is how you search for a Part D drug plan on an annual basis. Again, I recommend wholeheartedly that my clients do this because this is a way to save you some money on your prescription cost on a calendar year basis. And I think it definitely benefits folks to do that. If you like saving money like me, this is again a way to make sure you're saving money on your prescription costs on the annual basis. So I hope this information was helpful. If you have any additional questions, please feel free to reach out. Don't forget to like, comment, subscribe. And if you would like additional information on learning how to shop Medicare Advantage plans, which is the medical and the drug coverage together, please reference the link below to schedule a call so we can discuss those details together. Again, thank you for watching, and I'll see you on the next video.